12 signs. Your kidneys are crying for help. Hello, friends. Welcome back to our channel. Over 36 million adults in the United States have kidney disease, yet most are unaware of it. This lack of awareness is largely because the signs of kidney disease are often subtle and easy to confuse with other health problems. Many people don't experience noticeable symptoms until the disease is in its late stages, by which time the kidneys may be failing, or large amounts of protein have built up in the urine. This delayed onset of symptoms is why only 10% of people with chronic kidney disease know they have it. Medical testing is essential to confirm the presence of kidney disease. However, certain signs could suggest you have a kidney problem. People with certain risk factors, including high blood pressure, diabetes, a family history of kidney failure, or those over 60 years old, are particularly vulnerable. For these individuals, annual testing is critical in identifying the disease early before it leads to more serious complications. If you fall into any of these at-risk categories or notice symptoms that could be related to kidney issues, it's important to discuss them with your doctor. Early diagnosis and intervention can significantly slow the disease's progression, potentially preventing the need for more invasive treatments like dialysis or a kidney transplant. 1. Persistent fatigue. When kidneys start to struggle, one of the first signs you might notice is feeling unusually tired all the time. This isn't just the tiredness that comes after a long day. It's a constant, dragging exhaustion that doesn't seem to go away even after a good night's sleep. Your kidneys filter out waste from your blood and turn it into urine. When they aren't working well, toxins build up in your body, making you feel drained and sluggish. This tiredness can also be due to anemia, which happens when your kidneys aren't making enough of a hormone called erythropoietin. This hormone helps your body make red blood cells, which carry oxygen to your muscles and brain. Without enough oxygen, you feel weak and worn out. So, if you're feeling tired for no apparent reason, it might be a sign that your kidneys are struggling and need help. 2. Changes in urination. One of the earliest clues that your kidneys might not be doing well is a change in your urination habits. You might notice you go to the bathroom more often, especially at night. Or it could be the opposite, where you're not going as much as you used to. The color of your urine can also be a sign. If it's dark, it could mean that your kidneys aren't removing enough waste. Or if it's very light, it might indicate that they're not concentrating urine properly. Sometimes you might even see blood in your urine, which is a serious sign that something isn't right. Foam or bubbles in your urine is another signal, as it can indicate protein leaking from your kidneys, which isn't normal. All these changes are your body's way of telling you that your kidneys might be in trouble. 3. Swelling in ankles, feet, or hands. When kidneys start to fail, they can't get rid of extra fluids in your body as well as they should. This leads to a buildup of fluid, especially in the lower parts of your body, like your ankles, feet, and sometimes even your hands. This swelling is known as edema, and it can make your skin look puffy and feel tight. You might notice that your socks leave deep indentations on your legs, or your rings feel tighter on your fingers. The swelling is usually more noticeable at the end of the day, or after you've been sitting or standing for a long time. This happens because your kidneys are not filtering out sodium properly, causing your body to retain more water than it needs. This fluid buildup isn't just uncomfortable. It can be a sign of more serious kidney issues. If left unchecked, it can lead to complications like high blood pressure, heart problems, and further kidney damage. 4. Shortness of breath. Kidney problems can lead to a feeling of breathlessness that doesn't quite match the effort you're putting in. If you tire after just a few steps or struggle to catch your breath while resting, your kidneys might be involved. This happens because when kidneys aren't working properly, fluid can build up in the lungs, making it hard to breathe. Also, if your kidneys aren't making enough of the hormone that helps produce red blood cells, your body might not get the oxygen it needs, leading to shortness of breath. This can be particularly noticeable when lying down, as the fluid in your lungs can shift, making breathing even harder. Shortness of breath can be scary and uncomfortable, and it's not something to ignore. If you're experiencing this along with other symptoms like swelling or changes in urination, it's a sign that your kidneys may need attention. Proper medical evaluation is crucial to determine if your kidneys are the root cause of your breathing difficulties and to get the right treatment to ease your symptoms. 5. Unexplained weight loss. Unexpected and unexplained weight loss can be a sign that something is wrong, possibly with your kidneys. As kidney function declines, your body may struggle to balance the nutrients and fluids it needs, leading to unintentional weight loss. You might notice that you're not as hungry as usual or feel full quickly after eating just a small amount. This loss of appetite can lead to malnutrition, where your body isn't getting the energy and nutrients it needs to function properly. Further, the buildup of toxins in your body due to failing kidneys can make you feel nauseous or cause you to vomit, further contributing to weight loss. This kind of weight loss is concerning because it often happens alongside other symptoms, like fatigue or changes in urination, indicating that your kidneys are under stress. 6. Foamy or bloody urine. Seeing foam or bubbles in your urine might not seem like a big deal at first, but it can be a sign that your kidneys are leaking protein, which they're supposed to keep in your body. Normally, proteins like albumin stay in your blood, but if your kidneys are damaged, they might start to let these proteins slip through, causing foam or bubbles to appear in the toilet. This foamy urine is similar to what you see when you scramble eggs, because both contain the same protein. On the other hand, if your urine is bloody, it could mean that your kidneys are allowing blood cells to leak into your urine, which is definitely not normal. Blood in the urine can look bright red, pink, or even cola-colored, and it's a serious sign that something isn't right. Both foamy and bloody urine indicate that your kidneys are not properly filtering your blood, requiring immediate medical attention. 7. High blood pressure. High blood pressure and kidney problems are closely connected. Your kidneys help regulate your blood pressure by controlling the amount of fluid in your body and by releasing a hormone called renin that helps balance salt and water. When your kidneys are not functioning well, they might be unable to control your blood pressure, leading to high blood pressure. This can create a vicious cycle where high blood pressure causes further damage to your kidneys, making it even harder for them to work properly. Over time, this can lead to serious complications, including heart disease, stroke, and even kidney failure. If you've been diagnosed with high blood pressure and it's not responding well to treatment, or if it suddenly gets worse, it could be a sign that your kidneys are struggling. Keeping an eye on your blood pressure and getting regular checkups are important steps in protecting your kidney health. 8. Muscle cramps and twitches. Muscle cramps and twitches can be more than just annoying. They can be a sign that your kidneys aren't working as they should. When your kidneys are failing, they can't balance the levels of electrolytes in your blood, like calcium, potassium, and phosphorus. These minerals are vital for muscle function, and when they're out of balance, you might start to experience cramps or twitches, particularly in your legs and feet. The cramps can be quite painful and often occur at night, disrupting your sleep and leaving you feeling tired the next day. Twitches might feel like your muscles are jumping or contracting on their own, which can be both uncomfortable and alarming. 9. Dry and itchy skin. Dry and itchy skin can be a common problem, but when it's severe and doesn't seem to improve with regular moisturizing, it might indicate that your kidneys are struggling. Your kidneys have the important job of removing waste and excess fluids from your blood, but they also help balance minerals and nutrients like calcium and phosphorus. When your kidneys aren't working well, these minerals can build up in your body, leading to dry and itchy skin. This can feel like an intense, all-over itch that's hard to relieve, and it can be very uncomfortable, especially at night. The itching might also be accompanied by changes in your skin's appearance, such as it becoming paler or a yellowish tone. These symptoms can be particularly distressing and interfere with your daily life and sleep. 10. Nausea and vomiting. Feeling nauseous or vomiting regularly can signal that your kidneys are having trouble keeping up with their job of filtering waste from your blood. When your kidneys aren't working well, toxins can build up in your body, making you feel sick to your stomach. This can happen suddenly or gradually, and the nausea might come and go throughout the day. Vomiting can be particularly unpleasant, and it can lead to other problems like dehydration and weight loss, which can make you feel even worse. Sometimes the nausea worsens in the morning or after eating, and a loss of appetite might accompany it. This can make it hard to get the nutrition you need, which can further weaken your body. Treating the underlying kidney problem can help relieve these symptoms and improve your overall well-being. 11. Loss of appetite. Losing your appetite might not seem like a big deal, but when it's persistent and you're not eating as much as usual, it can be a sign that your kidneys are struggling. When your kidneys aren't functioning properly, waste products can build up in your blood, leading to a condition called uremia. Uremia can cause a metallic taste in your mouth and bad breath, making food taste unpleasant or even making you feel nauseous just thinking about eating. As a result, you might start skipping meals or eating less than usual, leading to weight loss and malnutrition. This loss of appetite can be particularly concerning because it can cause a downward spiral where your body isn't getting the nutrients it needs to stay healthy, making you feel even more tired and weak. 12. Difficulty concentrating or mental confusion. When your kidneys aren't filtering waste properly, toxins can build up in your blood, which can affect your brain function. This can lead to difficulty concentrating, memory problems, or even feelings of confusion. You might notice that it's harder to focus on tasks that used to be easy, or that you're more forgetful than usual. This mental fog can be frustrating and interfere with your daily life, making it hard to get things done or keep up with conversations. In severe cases, it can lead to more serious cognitive problems, where you might feel disoriented or have trouble understanding what's happening around you. This can be particularly concerning if it's accompanied by other symptoms, like fatigue or changes in urination, as it can indicate that your kidneys are not filtering out waste effectively. If you've noticed any of these signs, it's time to take action and give your kidneys the necessary care. Don't wait for the situation to get worse. Small steps now can make a big difference. Be sure to like this video if you found it helpful, and share it with someone who might need to hear this information. For more tips on keeping your kidneys and overall health in check, subscribe and turn on notifications so you never miss our latest videos. Take care of your health, and we'll see you in the next one.